And this is going to be a pretty relatively short meeting, but we are so thrilled that you're sharing some of your time with us today. I am personally really excited about today because this meeting today hits on a couple of things that Venture Forward and I get to do every day. We are the capacity building arm of United Way here in town, and a couple of the ways that we do that are around helping nonprofits learn professional development, kind of expanding our ways of thinking. And then we also we have a team in-house at Venture Forward here at United Way that does innovation work. So I'm going to get to share a little bit about an exciting innovation project we have coming out. And it's all about ALICE, asset limited, income constrained, employed. So we're very excited that you're here today to learn more about that framework. The way we're going to run today is Leslie is going to really kind of introduce a lot of us, do some teaching. We're going to do some learning around the ALICE framework, which is, like I said, really an interesting way to think about our working families, but who are still really struggling. Then I'm going to share a little bit about an innovation project, a collaborative kind of community-wide project that we're launching to more deeply understand ALICE households here. And then Dominique Brandt, who's our Vice President of Community Impact here. She oversees our community investments, some of our community programs like 211, our data team. Dominique's going to share some ways that y'all can get engaged with this ALICE work. So yeah, that's the way it's gonna run. I should say, while I have you, you probably have noticed that you only see the three of us. All of your cameras are turned off and will stay turned off. Chat's not on. We're pretty locked down. We had a pretty traumatic, terrible Zoom bombing situation earlier this week that we're reevaluating technology, and right now everything's locked down. So we're sorry we don't see your faces, but we get to see your names. And I should also say this is being recorded. Not that that matters since your faces aren't on it, but I think legally I'm supposed to say that we are recording this. And yeah, so those are the admin things. Everything's locked down. So if you think of questions or things that you have at the end, we're going to be sending an email out with a follow-up, and feel free to shoot us emails or questions or follow-ups over email, but it's not going to be available via chat today. So with that, I wanted to introduce Leslie Scarce. She's our president and CEO here at United Way. She's got a long history of working with children and families, but in particular, since she's been leading United Way, has just been, in my opinion, I might be a little biased, but doing a really good job of pushing us to think differently about the way that we work, the way that we invest, the way that we as a community come together to really kind of address some of our community's biggest challenges. So ALICE is one of those, and she is going to run us through this new framework and how we're thinking about it here in our community.
Thanks, Abby. Welcome, everyone. It's good to see so many familiar names and participants with us this morning. To your point, Abby, yes, we have been on a journey at United Way with our community to really transition from being a community chest to being a collective, collaborative community change agent. And I want to start today just with our vision. We envision a community where all people, all means all people achieve their full human potential through education, stability, and health and well-being. And in order to achieve this vision and to work towards this, we really believe it requires focus on critical problems that are affecting a lot of our neighbors. And we are getting clear on ours. United Way is really unique. We get to be an impact enabler, which means we can take data like we're going to see today and convene cross-sector partnerships. We are a deep believer in the nonprofit sector, but we also know that we're not going to solve these problems alone. And we need our partners from business and government and faith and education and neighborhoods, all teaming up together in order to see real transformation. And then we mobilize problem solving. We get to throw volunteers and resources and data and training behind and dollars and investment behind some of these solutions. So today's conversation is really timely for a couple of reasons. One, I hope you're going to see the urgency that's impacting so many of our neighbors, and COVID has made this all the more real. But we are also in the midst of a transition at United Way. Our own transition as our community investment process, where we invest dollars and resources into incredible frontline nonprofit partners. We're transitioning to get clear on what that process and what that focus is for the years to come. And we've also redoubled down our commitment to practicing equity in the work we do every day. And so this Alice work is very timely for those two reasons. So let's just talk about why for a minute. We're even talking about Alice. We wanted at the United Way to get a much deeper understanding of financial instability and to get a clear picture of how many low to moderate income households are really slipping into poverty, that are, one flat tire or one medical bill away from a severe financial crisis. And one of the reasons why this was important to us is that the federal poverty rate has not been changed since the War on Poverty in 1965. I think we can all agree that life has changed just a little bit in terms of expenses and our economy and our community since 1965. But the other reason why this matters so much to us is that we know the value of Alice households and essential workers. And if one positive thing has come from COVID, I do think it's opened our eyes to the sense that those who keep our economy running, I believe morally, should be able to support their own families. Like, our Alice workers hold jobs that are essential to our day-to-day quality of life. They care for our children, they teach our children, they maintain our infrastructure, make sure we have food on the shelves of our grocery store, they wait our tables, they repair cars. Bottom line, Alice keeps our economy running. And as our neighbors, their value and our value collectively is immeasurable. So what we did is we partnered up with United Ways across the state of Tennessee, partnering also with Princeton University, who are the primary researchers on this Alice project, and other communities around the nation who wanted to see high quality, research-based information to give us a better understanding of who's struggling in our communities, revealing, frankly, a much broader swath of neighbors that we don't always see. We don't always hear, especially when we focus on just the term poverty. So what you're going to see today is that the hope and the why behind this work is we want to together empower systems that impact our essential households, impact our neighbors. Alice is not designed to condemn or label. It's really to help us uncover why so many of our neighbors are struggling, the impact of that, and what we can do at the root to make a difference. So let's move on. Who are Alice households? What does this even mean? Alice stands for asset limited, which means no safety net in times of crisis, income constrained, which means their income falls short of basic essentials to live, and employed. So oftentimes, or every time, Alice is working, especially pre-COVID, but not earning enough. Bottom line is they work hard, sometimes more than one job, yet face different levels of financial strain that make it hard to afford basic necessities like childcare, housing, healthcare, a cell phone. Here's what's critical. Alice households fall above the federal poverty line. So government benefits or entitlements are not often available, which frankly puts Alice in a tough position of oftentimes not knowing where to turn for help. Typically, Alice households also have limited savings, meaning only one setback away from true financial crisis and instability. Now, hear this, friends and colleagues. Prior to the pandemic, before COVID-19, we estimated that before the pandemic, 42% of households, 42% in Hamilton County fall below this Alice threshold, okay? Stick with me. That means 11% living under that federal poverty line, 31% below this Alice threshold. And we define that by talking about a household survival budget. And you'll see the notes that we send afterwards. That household survival budget really is basic survival. Basic survival. Looking at things like, as we said before, like food on the table, keeping the lights on, having a home to live in. We know that today, because of the COVID-19 pandemic, countless Greater Chattanoogans have been impacted, and I expect that number is far higher than that 42% today. Bottom line, cost of living outpaces earnings, and it makes for impossible choices for Alice households. Do I feed my children or keep the lights on? And y'all, the impact of this is huge. It impacts our children living in daily toxic stress of instability. It impacts our communities, it impacts our economy. In fact, this is really compelling. If all households in Tennessee can move to that Alice threshold, that basic survival, due to an increase of financial stability and greater earnings, we would add $78.2 billion to the Tennessee GDP. This is an issue that impacts down to our children and our individual households all the way to the collective. So we talked about the Alice thresholds. I think it's something to also important to note that Alice households don't just fit one demographic. So as we learn together, not only have we had major shifts in household composition, but the way that this this threshold has been calculated is by looking at all types of household: single, aging adults living alone at home, married parents with 2 children, family of 4, single parent, multiple children. We're able to look at what does financial instability look like with all types of households. But it is important to know this: regardless of how our household demographics are changing, all types of households are struggling. And Alice and poverty level households exist across all of these living arrangements. A note around equity that's also very important is the data shows that our Black households are disproportionately impacted. 64% of Black households in Tennessee are unable to afford basic necessities, juxtaposed to 42%. So let's move on. Let's dig in a little bit deeper. How do we understand Alice households better? Well, as you can see here, it's a complex web. We're human, right? And communities are made of systems, and they're oftentimes messy. It's like peeling back an onion to understand the various systems and life experiences that are impacting so many of us and our neighbors. So basically, the cost of living of Alice households is increasing and wages are stagnant. That is one critical issue. We know that the federal poverty line, get this guys, for a family of 4 is $24,600. $24,600 for a family of 4 annually. Imagine what it really costs for housing, childcare, food, transportation, healthcare, technology, just to live. And we know that family costs are increasing statewide about 23% over the last few years, and that's high above the 11% of inflation. So yes, there is a cost issue and a wages issue, but it's more than that. We also have great concern and local data around jobs. A lot of outsourcing that is predicted to happen in the next decade or 2 means that a lot of Alice jobs that are essential are going to go away. So creating pathways is essential. But again, it's not just about employment. We're also very deeply looking at the lack of quality and affordable childcare. In fact, childcare is a lot of families' greatest expense. Right here in Hamilton County, it costs $9,000 for one child to be enrolled in early learning and up to $14,000 for 2 kids. That's nearly impossible based on the household income I just shared with you. We are also looking at out of school time when kids are not in school. Over breaks and over summers, what are the opportunities and the systems that are there for their growing and also for support of the family and their work? We're looking at food, the cost of food and the accessibility to food, health, cost, access, quality, and usage. So many of our Alice families are one medical emergency away of being thrust into crisis. Housing, how many of our neighbors are rent burdened? Transportation, not just the cost of having transportation, but being able to get from your home in Soddy Daisy downtown to where the work is. On and on, there are many issues that are impacting Alice households. And I would be remiss if I didn't mention some of the policy impacts. We are very concerned at United Way and are going to dig more deeply into the fact that policies that impact what we call the cliff effect are in play for a lot of Alice households. If you earn more, you lose benefits and you end up being set back. These are things we've got to get to the root of together. And finally, I've got to just make a nod to connectedness. We've also found that even as these systems are impacting so many of our households, that relationships and having a safety net of people around us makes a huge difference for families to stay strong and stable. We all know folks who might be economically challenged, but they're relationship rich, and that buffers us, right? So in this work, we're also thinking about the idea that connected community changes everything. And that when our households hit crisis, we need to know where to turn to give help and also get help. Folks, we know COVID has impacted Alice as well. I mean, that's just, I think, obvious to everyone on this call, but between school and childcare closures, the digital divide, so many women leaving the workforce, non-essential job insecurity, this makes this work more urgent now than ever. So here's my last slide. Let's get local. What does this actually mean for us in Hamilton County? Well, our data has been able to drill down zip code by zip code and also even neighborhood by neighborhood, examining how many of our families qualify under that ALISH threshold. And how do we look more deeply at things that matter that I just mentioned, like internet access and income inequality, rent burden? What's really happening on the ground? Friends, you're going to see here that in District 4 in Hamilton County, 75% of our neighbors in this one district fall at the poverty line or below the ALISH threshold. That means 75% of households in this part of our community can't afford basic necessities. Let's get real clear. Working families, struggling families are not the problem. They're the solution, right? To strong community, to strong workforce. And they're our neighbors that we care about deeply. They're us. They're our children. They're our friends. They're our employees. Bottom line, if we're going to achieve our vision of opportunity for everyone in our community, we've got to dig deeper and understand the day-to-day experience, including work, play, life, expenses, and the underlying things that are impacting our communities and causing so many of us to struggle. So that's what this work is all about. The data is compelling. It is an urgent call to action, but data only says so much, right? The numbers are numbers. We believe really deeply at United Way that we can come together to begin to solve problems that no one person or no one organization can do it alone. But we have to ask the right questions, and we have to do it with a spirit of learning and empathy and understanding. So what Abby's going to share with us is how we're going to move forward with this. We've seen the data, but here's what really matters. How do we put our assumptions aside, listen, learn, dig into the day-to-day life of so many of our neighbors and those that we work with and serve, and do it well and do it together. Then we can begin to chart a path forward that makes a difference for so many of our Greater Chattanoogans. So Abby, talk a little bit about what that means, how we're going to move forward learning together.
Will do. Thanks, Leslie. Yeah, so many of y'all have probably been engaged in some of our innovation efforts over the past couple of years. This one is kind of an outgrowth of some of the design thinking work that we've done with Bridge Innovate over the last several years. And we're calling it the Alice User Experience Project. So for those of y'all who come from a business background, you might be familiar with the term user experience, but you might not. It's basically how a customer interacts with the system, the product, the experience of them interacting with the thing that's being delivered to them. And so one of the ways that you can really more deeply understand your customer's experience is by developing what they call personas around the different types of customers that you have, and then very meticulously, very intentionally getting to know customers and personas who fit that bill, and understanding how they navigate through your product or service. In our case at United Way, and in the case of Alice, we think of the product or service as the collective kind of system, the ecosystem of support that our community comes and puts around these Alice households. So what we're doing is we are actually convening a group of community stakeholders. We've put together a core team of people, about 15 of our community partners that we work with pretty regularly. Some actually not. Some of them are folks we haven't worked with recently. Really diverse group of folks to come together and literally build these maps where we can visualize how an Alice family navigates the system. What supports do they have? Where do they not have the supports that they need? Understand their daily lived experience navigating all the challenges that Leslie just articulated. So can we go to the next slide, Patrick? Sorry. So the way that we're envisioning this project is kind of in a two-phase cadence. Right now, we're just launching phase 1, which is all about empathy building, understanding. For those of y'all who do know design thinking, it's the getting to know your customer and the human behind the data. The core team that we've put together is really going to dig in with the Venture Forward team and Bridge Innovates facilitation on getting to know individuals and families and community more deeply. Again, as Leslie said, we have this data. She took it down to the district level. We're going to take it to like the family level. We really, really want to understand how an Alice family and household navigates this system. So that's where we're at. Phase 1 is all about more deeply understanding Alice households. In phase 2, after that, we're kind of designing it as we're flexible, but phase 2 will then be about how do we as a community act? Like, what do we do in response to the data that we have and the lived experience that we're hearing from households? So that'll be phase 2. Right now, we're really just focused on understanding. And at the end of the day, it's all about, what Leslie alluded to. How do we as not just United Way, but as a community, help Alice households, achieve their full potential? We're all about opportunity. What needs to change? Where are the gaps, and how do we change the system to better support Alice households? So one thing that you're going to see, I mentioned the core team. And Dominique's going to get into this as far as how you actually do this, but we have the core team that's working on developing these maps. We also are inviting general community members. That's you all, that's your networks, that's your board members, that's your clients you serve, whomever, to join in through our community stakeholder group. There will be actual report outs and report feedback giving sessions, kind of two-way, that our project team is calendaring. And we would very much love for y'all to join if you're interested, if this work speaks to you, for you to join in on this effort and be a part of really digging in and understanding Alice households in our community. So with that, I'm going to let Dominique tell you share a couple of easy ways that we have for you to get engaged in the Alice work.
Thanks, Abby. Wow, that's got to be the fastest 26 minutes in a long time. That was a lot of information for any of us to take in and even begin to digest in this amount of time. But as we've said, really understanding the Alice household experience is the first step to that transformational change that is needed so that all of our neighbors are able to achieve their full human potential through education, stability, and well-being. We hope that this little taste of what you've heard about Alice and the user experience has gotten you as excited as we are, because we are very excited about this. But we know that this is not going to be a sprint. This is a journey. And we're really hoping that you all will join us on this journey of discovery so that together we can figure this out and really help the stability of our neighbors and our community as a whole. The project page on Venture Forward's website has an engagement form, which will provide you the opportunity to join our mailing list. And that's probably like the easiest thing. You'll be getting updates that you'll be able to read and comment on as you like. What we'd really love for you guys to all do is join the user experience project as a stakeholder or collaborator, as Abby said. Please know that it's not going to be a huge time commitment. It's not like we're going to ask you to be doing something every single week, but it will give you a really intimate opportunity to hear the feedback from the core team and provide feedback to them as to where they're going, how it's going, what you're seeing. Maybe they're missing something and you want to share that. This is a great opportunity to be able to engage in this manner. You'll also have on that page a link to United for Alice, Tennessee, which is where the repository of all of this data that Leslie was talking about that has been worked through through Princeton and collects information not just for our community, but for all of Tennessee. So you will be able to see lots of rich data and have lots of information there. After our webinar is completed in about a minute and a half, you guys are all going to receive an email. It will have links to the project page on Venture Forward's website and the opportunity for you to engage in one of these three ways or all three. You will also have a brief survey. Let us know what else you need to know about this work, what else you're interested in knowing, how we can communicate it more effectively. Thank you all for taking time this morning. We know your time is precious and it is greatly appreciated. And we hope you have a wonderful Thursday in this beautiful springtime weather. Have a great day, everyone.